52.4 million per million doses. That's one case in 19,000. And 56.3. Actually, in that particular age group, it's a bit confusing there. Let's go by the graphic. That is what it says in the paper, but the graphic indicates that that's not correct. So I'm not quite sure if that's just a fault in the way the paper's written. Anyway, that works out at one case in 17,000 and a bit. Now, myocarditis under 30. 826 cases who had detailed clinical information available. As we said, quite a few didn't have detailed clinical information. And again, we'll see the gaps in the data here become obvious. 792 over 809, 98% had elevated troponins. Now, troponins are associated, in the heart there's contractile fibres that cause the heart to contract, so it contracts and then relaxes. And troponins are part of these contractile fibres. And if a heart cell is damaged, if a myocyte is damaged, these components of the contractile fibres that are supposed to be kept inside the cell get out into the blood, and it's a sign of cardiac cell damage, basically. So it means that most of them had damage to their myocytes, their myocardial cells. 72% abnormal electrocardiogram results. And again, there are criteria for this. So the electrocardiogram is just the way the heart is beating. You probably, in the UK we call it ECG, in the States they call it EKG. So you have a P like that, then you have a QRS complex like that, and then you have a T wave like that. And they're equal, that they represent the electrical activity going on in parts of the heart. So that is the contraction of the top chambers of the heart, atrial myocardial contraction. This one here, the QRS, so that's P, Q, R, S is the contraction of the QRS complex is the contraction of the ventricles, the main pumping chambers, and the T wave is the electrical activity of the main pumping chambers going back to normal. So a normal rhythm's got a PQRST roughly in the right order, and the rate is exactly in the right order, and the rate is between 60 and 100 for a sinus rhythm. So that is a normal sinus rhythm. So there's an abnormality of this. 72% had cardiac magnetic resonance imaging results. So 72% had MRIs, and the good thing about these modern cardiac MRIs is you can actually see the heart contracting. So it gives you kinetic information about the contractility of the heart, which of course can be impeded if there's inflammation of the heart muscle. Hospital data, 96% were hospitalised, so most of these patients were hospitalised, of the ones that were recognised, of course. 87% had resolution of symptoms by discharge from hospital, which I suppose is good. But of course that means 13% didn't. So, it's kind of easy to put this in a particular way. 13% didn't. Most common treatment was non-steroidal anti-inflammatory drugs, such as the most simple one that everyone knows about, of course, is aspirin. The more common one these days are ibuprofen in the UK, naproxen, diclofenac. They've probably got different names in the States, but these are the non-steroidal anti-inflammatory drugs, which are very good analgesics. And it doesn't mention this, but paracetamol or acetaminophen is also good for pericardial pain. Surprisingly, I used to treat patients with pericardial pain, and they often responded better to paracetamol, that's acetaminophen or Tylenol, than they did to morphine. Strange, but absolutely true. These were the figures for 16 to 17-year-olds. Now I know you can't see this, but that's the incidence after the first vaccine, which was 7.26. That's the incidence after the second vaccine, which was 105. That gives a total of 113.12 cases, and normally you would expect 1.34 in the same time period. The expected is 1.34. So 1.34 divided into 113.2, I get 84 times more likely. But as we say, the real number is probably way higher than that. Now, I don't know how much detail to go into today, but this is the supplement that we get. So I'm just going to mention this a little bit because there are some causes for concern here. So presence of one or more new worsening of the following clinical symptoms: chest pain, pressure or discomfort, shortness of breath, difficulty breathing, pain with breathing, feeling your heart beat inside your chest, palpitations, syncope is fainting. But as well as that, you need to have a pathological confirmation. Now, this would only be detected on post-mortem because I really can't imagine they're doing cardiac biopsies. So histopathology, of course, is where you look at the heart under the microscope or some of the tissues under the microscope. And the idea that you would do that in a living person is, I've never seen it done. Maybe some centres do it. So if you're a clinician working in the States and you do cardiac biopsies on living patients, then do let me know. But I will be surprised. So, but if they didn't have that, which they probably wouldn't, then they would need an MRI. So it's getting quite difficult to get to be a confirmed case. So you have to have the presence of one or more of these, fair enough. But then you have to have that, which will probably never happen, or you have to have an MRI, which can be difficult to obtain. So you had to have a cardiac magnetic resonance imaging finding consistent with myocarditis and troponins. So they're kind of making it a little difficult and no other identifiable causes. To be a probable cause, you need those same things as well, probable case rather. So those same clinical criteria. And you also need troponin levels above the upper limit, fair enough, an abnormal ECG, or rhythm consistent with myocarditis, abnormal cardiac function or wall motion, as we said with MRI or sometimes ultrasound scan, or MRI findings. So they're making it quite difficult and to eliminate cases. So you could say they're being exacting, but that could mean that some people this could mean that some people with, say, mildly inflamed myocardiums aren't being put forward as a probable or confirmed case. It could mean that. And again, quite difficult to die. So ST segment or T. I'm not going to go into these, but you can see there's extra criteria there. So ST segment or T wave abnormalities. I mean, I'll just explain the first one, the ST. So as we said, the normal rhythm is the P QRS, and the T wave. So remember that's P Q RST. So an ST abnormality would be an abnormality between there and there. So what you might have, for example, is you'd have a QRS, and then something like ST elevation like that before the T wave. So that would be an abnormality of S. So the S, that would be the S there, and the T there. So there would be an abnormality in those bits. So instead of going down like that, it might just go like that. So these are fairly specialised things, and I'm not going to go into them. I'm not going to go into them in detail. It does mean it's fairly the specific criteria. It's not any change in the ECG. In other words, there's these specific criteria. Now, reports on the VERAS system. It says this on the VERAS website here. The Vaccine Adverse Events Reporting System is a passive reporting system, meaning it relies on individuals to send in reports of their experiences. Anyone can submit a report to VERAS, including parents and patients. So anyone can do it. Or can they? Because let me just show you the form that needs to be filled out. Now, here we have part of the form here. Part of the form. So you would have to decide whether there's any anaphylaxis, coagulopathy, COVID-19, death, Guillain-Barré syndrome, Kawasaki disease, multisystem inflammatory system in adults, multisystem inflammatory system in children, myocardial infarction, myopericarditis, narcolepsy, pregnancy, seizure, stroke, transverse myelitis, or other. Now, this is not a quiz, but how many members of the public would know what the heck that was talking about? I mean, you might know what anaphylaxis is, the severe allergic reaction. You might not, but why should you know that relates to abnormal clotting of the blood? you wouldn't have a clue. GBS, how do we even know it stands for Guillain-Barré syndrome, let alone what it is? Kawasaki disease, an inflammatory disease, myocardial infarction, blocking off of part of the heart muscle, myopericarditis, inflammation of the myocardium and inflammation of the pericardium and myocardium, narcolepsy, you're always falling asleep, seizures, fitting, stroke is a cerebrovascular accident, transverse myelitis, it is a transverse lesion across the spinal cord. So if that's a spinal cord running up and down there, transverse myelitis will be a lesion that goes across that. But I mean, that's not. How could a member of the public fill that out? They simply wouldn't have the. It's like me doing a flight check before takeoff on an aeroplane. Whether the flaps are right. I don't have a clue. Also, you asked they'd asked you to identify other infections. So the member of the public, it would appear, is expected to know whether the infection was adenovirus, Coxsackie virus. I mean, how could you know any of this stuff? It's all specialised stuff. Another part asks you to say if there's any rheumatoid arthritis, scleroderma, systemic lupus erythematosus, Sir-John syndrome, or other inflammatory diseases. I mean, how can a member of the public do that? Also, another part of the question here is ST elevation abnormalities, T-wave abnormalities, PR depression, atrial, supraventricular or ventricular arrhythmias, conduction delays or block. AV, that stands for atrioventricular block, first degree. Who knows? Unless you're a cardiac nurse or a cardiologist, you're not going to know these things. Try these out on an average GP and see if you can remember them. You probably won't be able to. Unless you've done cardiology recently. Or another part, decreased left ventricular function, pericardial effusion. What is an effusion? Well, an effusion is a collection of fluid, but how would you know that? Ejection fraction, all these things, how would you know them? So how on earth a member of the public could fill out one of these forms? Well, they couldn't. I don't see how they could. I just don't get it. So you are relying on the patient's doctors to fill it out, or specialist nurses who have knowledge of these things. But the idea that I actually struggled when I read that. It actually said that anyone can submit a report to VRAS, including parents and patients. It would be interesting to know what proportion of these forms were sent in by parents and patients in the individuals, because unless they were clinicians themselves or some sort of medical scientists, I don't see how they possibly could. Correct me if I'm wrong, but I don't get that bit. So there we go. Now, the last question is, has there been any previous myocarditis, pericarditis from other vaccines? And the answer to that is yes. Previous vaccination of myocarditis, only smallpox vaccine is the only one though. American military personnel, but that wasn't 7 to 12 days after vaccination. So this pericarditis, myocarditis does seem to be unique to the mRNA vaccines. And of course, I'm reminded that we talked to one of the leading scientists in Denmark about this, Professor Niels Høiby, on a video on this channel. And he compared the incidence of myocarditis in Denmark to Norway. And of course, in Denmark, they are aspirating before injecting. So they stick the needle in and they draw back to make sure they're not in a vessel. And if the blood comes out and they think they're in a vessel, they're not going to give it. So that's in Denmark, whereas in Norway, they don't bother. And he found that there was 3 times more cases of pericarditis in Norway where they don't aspirate, as opposed to Denmark where they do aspirate. Therefore, everyone should be, in my view, everyone should be aspirating and eliminate that variable, but that's not being done. Okay, a bit complicated today, so hope you followed that. So we can say that there's more myocarditis. It's increased after vaccination, and the 133 figure times 133 figure we don't have data for. The times 84 figure we do in that particular age group, but for the reasons I've mentioned, it's probably more than 133 times. So what I would appeal is for this to be covered more on mainstream media so that people can make informed decisions. That's what this is about, giving information.